Hi, thank you for joining us on this webinar, which will provide a brief overview of the results of a recent survey of Ohio's charities and how the coronavirus has impacted their operations thus far. My name is Beth Short, and I'm with the Charitable Law Section of the Ohio Attorney General's Office. The survey was developed through a partnership with the Charitable Law Section and Philanthropy Ohio, which is the statewide association of various funders and foundations, with special thanks to Claudia Harold, as well as Ohio State University professor Aaron Beaton. And Claudia and Aaron both serve on the Attorney General's Charitable Law Council, an advisory council that assists our section in developing training and other sorts of responses for the charitable section in Ohio, and we thank them for their interest in their participation. Other members of the Advisory Council have also been involved in this survey. This survey will be repeated over time so that we can have a complete picture of how the coronavirus situation has impacted Ohio's charitable sector. Thank you to those who completed the survey, and thank you in advance to those who will continue to respond over time. We wanted to do this survey because we knew that the coronavirus would impact the charitable sector greatly, and that those various impacts would be felt both on the short term as well as in the long run. We expect there to be a financial impact that this crisis will cause. Charities, many have had to cancel major fundraisers for their organizations. Many have seen donations slacking off. Many are concerned that their donors themselves are now facing unemployment and other financial crises. Programs have been affected. Many have had to call a halt to their programs. Others have seen steep rises in need for those that they serve. Clearly, staffing has been affected, both paid and volunteer staff, and the coronavirus situation and the various health orders have definitely had a huge impact on community needs and how charities are filling the gaps. This is a time where adaptability will be critical. Charities will have to be flexible and creative in how they respond to these various challenges. This is not a time to sit back and relax. In fact, this is a time for leaders and board members, paid and volunteer staff to buckle down and pay attention and engage in strategic thinking. Board governance issues continue to be important during this pandemic. We've had many calls to our office about teleconferences, and yes, Ohio Revised Code Section 1702 permits charity boards to meet by teleconference and Skype and Zoom. So continue having meetings. You must protect the assets that you have. If you've closed a facility, there still needs to be someone who is checking to make sure that the mail that comes in that may have checks is being secured and that your physical assets are being protected during this time. Communication is key. Letting your volunteers, your donors, and the whole community know what's going on with your organization, whether you've reduced hours, expanded them, whether you have increased needs for volunteers. Letting people know what is going on is going to be very critical for charities to survive in the long run. And then, just like every other organization, charitable leaders need to be monitoring the news for announcements about how various health orders might be impacting the work that you do, as well as for news about unemployment benefits that may affect your employees, or various loan and other sorts of relief efforts that are out there for charities as well as other businesses. If you click on the Services for Charities section of the Ohio Attorney General's webpage, you'll find that there are various updates there. In fact, our recent nonprofit newsletter contained a number of items that are critical for charities to be thinking about at this time. You should also be monitoring the state of Ohio's coronavirus.ohio.gov page for developing news about the coronavirus and various restrictions and various efforts to help bring back the economy. Charities qualify for many of the relief programs that are out there. And our partner in this survey, Philanthropy Ohio, carries a lot of information about the various programs, limitations, and assistance out there for organizations during this time.
Hello, I'm Erin Beaton. I'm an assistant professor at the John Glenn College of Public Affairs at The Ohio State University, and I'm here to share the main findings of the survey with you. Before I get into the results, let me tell you a little bit about how the survey was administered. An invitation to participate was emailed to the list of charitable organizations that are registered with the Ohio Attorney General's office. The list included all 501c3 designated organizations, both public charities and private foundations. It didn't include other tax-exempt statuses like 501c4 or C5, or nonprofit organizations that aren't registered with the state. For instance, religious organizations aren't required to register. In the email was a link to the online survey, and here's a screenshot of what one of the pages looked like. The survey asked questions about how the COVID-19 public health crisis was impacting the organization and about the organization itself. The survey was first sent out on April 9th, and the results I'll share with you today were as of April 20th. Ultimately, over 7,700 charitable organizations responded to the survey. The responding organizations came from all over the state. 8.3% of the organizations said that they serve the entire state of Ohio. 23.3% serve Northeast Ohio, 15% serve Southwest, 14.1% serve Central, 9.1% serve Northwest, and 6.1% serve Southeast Ohio. Generally, the organizations that responded are similar in composition to the nonprofit sector overall. As you can see here, the organizations were diverse in their missions. The largest number provide human services such as food, shelter, and youth development. Also in the sample were health, education, and arts organizations, animal shelters, parks, religious organizations, and foundations. On average, public charities are quite small. While some very large organizations responded to the survey, for instance, several over $10 million in annual revenue, most of them were small. Over 50% have revenue of $50,000 or less each year, and over 60% have no full-time staff. The first question we asked on the survey was whether organizations were currently delivering their services. We found that a large proportion, 28%, are not providing services during the pandemic at all. Another 50% are providing services at a moderately or severely reduced capacity. Only 10% said they were operating as usual, and 8% said they were providing services to a greater extent than usual. There are certain types of nonprofits that we'd expect to be closed down, like performing arts theaters, and other types of nonprofits that we might expect would be operating at a higher capacity, like hospitals. However, that wasn't necessarily the case. For instance, there are many arts organizations that are still operating and some hospitals that are not. This tells us that there's more impacting an organization's service provision. Even if there's a higher demand for their services, there may be other things getting in the way of their operations. We also asked the survey respondents what actions they were taking to fare the pandemic. We asked about several specific actions that are listed on this page. Of the actions that we asked about, conducting board meetings virtually was the most common response, with 51% saying they were already doing that, another 32% saying they were considering it, and only 7% saying they weren't considering virtual board meetings at all. Continuing strong governance practices despite the pandemic is important, so we are glad to see this was the case. Other common actions being taken are restricting travel and cutting administrative expenses. Some of the actions we asked about had to do with staff, and we know that many of the responding nonprofits don't have employees, so some of the questions weren't relevant to those organizations. But of the organizations with employees, many were restricting professional development of staff, applying for the federal payroll protection program, and freezing hiring. A few common actions that are more broadly relevant are drawing on reserves, changing internal or financial controls, and making a special appeal to donors. As you can see at the very bottom of the chart, many of the nonprofit respondents don't have an endowment, 72%. So increasing the draw on an endowment isn't a choice. But of those that do have an endowment, most of them are not considering drawing more from it than planned. One line item up from that is a question about removing restrictions from donations. When donations are made for a specific use, it's incumbent upon the nonprofit to ensure the funds are put toward that use, and it's called a restriction. Most are not considering trying to remove restrictions, but for the majority of responding nonprofits, this wasn't applicable because they don't have restricted funds. We also asked respondents if they wanted to add any action. The last thing we asked about in the survey was the concerns of nonprofit leaders. Again, we provided a list of specific concerns we thought would be common. Of the list we provided, the most common concern among respondents was the loss of revenue, with 49% very concerned about lost revenue, 28% somewhat concerned, and only 9% not at all concerned. Closely related, a couple line items down, is decline in donations, with 45% very concerned, and loss of revenue specifically due to event or program cancellations had 36% very concerned. Tying closely to the question of service provision that we covered earlier, 47% of the respondents suggested that they were very concerned about disruption of services to clients or communities. Most worrisome to me personally was the line item halfway down about having to shut down operations indefinitely. 25% said they were very concerned, and another 29% said they were somewhat concerned that would be the case. Again, there were some questions at the bottom that did not apply to a large number of respondents because they don't have government grants or a dedicated facility for which they have to pay a mortgage or rent. Still, of those with government grants, about a third said they were very concerned that they would not get reimbursed, and of those with a mortgage or rent to pay, a little less than that said they were very concerned about paying it. The respondents also provided open-ended answers offering things they were concerned about that we may have missed. Here are the top 5 concerns they mentioned. At number 1, canceled or postponed fundraisers or events. Again, because these events are key drivers of income. At number 2, uncertainty and timing of when things will begin getting back to normal. Many discussed how hard it is to plan financially and logistically when there are so many unknowns right now. Number 3 was the inability to reach or support beneficiaries. Organizations providing in-person services were particularly affected by this, including drug rehabilitation, after-school youth development programs, churches, and sports leagues. At number 4 was ongoing or sunk costs. Some were concerned about utilities or paying employees or having already made purchases toward events. And at number 5 was changes to service delivery. Many organizations were concerned about whether they could feasibly provide services virtually, and if they did, whether they would be of a high enough quality to achieve their missions.
If you need to reach the charitable law section, the best way to reach us is by sending an email to charitableLaw@ohioattorneygeneral.gov. Again, charitableLaw@ohioattorneygeneral.gov. Thank you.